Welcome, everyone. Good afternoon for some and good morning for others. Uh, and I want to welcome you to our workshop. This is workshop number 5 in our series on addressing youth vaping through the strategic prevention framework. And today, we're going to focus on the final but absolute essential step of the SPIF, and that is evaluation in action. My name is Derek Newby. I'm your TTA specialist for Region 6. And I just want to share with you that evaluation is where we learn what works and we learn what's working. We also learn what isn't working and what needs to change. It helps tell us the story of our efforts, demonstrate impact, and make smarter decisions moving forward. So, whether you are implementing school-based programs, community outreach, policy strategies, or partnerships, evaluation ensures your work stays effective, relevant, and responsive to real community needs. So in this session, we'll explore practical ways to design evaluation plans, track progress, use data for improvement, and communicate results to our community. And with our goal today being to give you simple, actionable tools that strengthen your prevention strategies and help you continuously refine your approach to youth vaping. And it can be applied to other things as well. So thank you for your commitment throughout the 5-part series. If you've attended every part of the series up until now, if you could just put your digital hand up and wave it right now so we can see how many hands are up there. Everyone who is, yay, let me see all those hands fly. If you've been to all sessions, thank you so much. We appreciate that. Thank you for your commitment. Your dedication to prevention and your willingness to engage in this work is what makes community level change possible. So let's get started with evaluation in action, where we turn knowledge into learning and learning into impact. I'm going to talk with you briefly about the acknowledgments. I can have the next slide, please.
There you go.
In our acknowledgments, we simply want to make sure that you know we ask you not to reproduce or redistribute this publication for a fee without specific written authorization from the University of Oklahoma, and be sure that you understand no official support or endorsement of DHHS or SAMHSA for the opinions described in this document is intended or should be inferred. Your learning objectives for today are quite simple. We're going to outline the purpose of evaluation within the strategic prevention framework. We're going to explain why evaluation is important, and we're going to apply evaluation strategies to youth vaping prevention. This is your roadmap for today. And in your roadmap, we're starting with introductions. If you would introduce yourself in the chat by putting your name and your title and how long you've been working in prevention. You share that with us, and the other attendees can see that as well. We'll talk with you about the SPIF, let you understand the purpose of evaluation. Talk about logic models. Just yesterday, we were really interested in logic models, and we're going to give you some more logic model information. We'll talk about youth vaping examples. You'll get the opportunity to ask us some questions, and most importantly, evaluation time. It's not over till the paperwork is done. So we need you to tell us how we did so we can do better in the future. We're here for you. Without further ado, I'm going to put you in the capable hands of Nicole Shaneborn, my trusted colleague, to introduce our speaker.
Thank you, Derek. And you all are in for such a treat with Kyle. Kyle and I have done a lot of face-to-face trainings together on that favorite topic, logic models. So we are very lucky to have him here today. Kyle brings more than 30 years of experience in substance misuse prevention, treatment, and evaluation to us today. His career has included roles as a substance abuse counselor. He's also done work with a treatment center and a shelter for runaway and homeless youth, as well as a hospital unit for adults and youth. He's led evaluation efforts for local and statewide prevention organizations, authored multiple peer-reviewed articles, and conducted over 200 program evaluations. That just makes me tired thinking about that. His expertise supports communities and coalitions in data-informed planning, logic model development, and outcome measurements. So I will now turn over to Kyle. Welcome, Kyle.
Hey, well, thank you very much, Nicole, for that warm introduction. Derek, as well, appreciate the kind of the framing of where we are today, and the whole OU PTTC team for supporting this training. But most importantly, I want to thank you guys for being here on a Friday afternoon, especially after the Texas A&M Aggies were elected into the college football playoffs for the first time in our history. So any Aggies out there, double thumbs up. And so as we go through this next process, that's why I'm wearing maroon. And so hopefully as we go through this process, we'll eliminate a lot of the football chatter and really focus more onto the evaluation. But as you're going to learn from this presentation, football and evaluation have a lot of things going for them in terms of outputs and outcomes and other parts of the evaluation piece. But most importantly, thank you for being here on your Friday afternoon. As we go through this process, I do want to emphasize that this is your training. So if you have questions, please use the chat. We have some moderators there that will make sure that you are heard and that your question is asked. If we can't answer it here on this call or during this presentation, we will work to get you that answer. But no question is silly or too simple. Please ask away, because I would rather have you ask that question and know that we're going to follow up with you than not ask and never get an answer to that question. As we go through this process, we always want to start evaluation with, kind of a pre-test. And so as you go through this process, one of the first questions we're going to have for you today is this pre-assessment question number 1. We'll give you about a minute to read this, and then we should have a poll that is available to you to answer, and then we'll see what the results are from that poll. So we'll give you about a minute to talk about what the primary purpose of program evaluation within the SPFS is. And then, of course, if everything goes right, we should have a post-assessment at the end, and we'll see if there's any change. All right. So as we go through this process, looks like there are people out there who have different ideas as we go through what prevention is and evaluation is. That's perfectly acceptable. So as we move through it, important to note as you go through this that each one of these has a part of evaluation. So we'll talk about each of those. Very good. Well, that looks like about most of the people have answered. We're at 57%. We'll give you about another 15 seconds before we go to the next question. There's only 3, so we're not going to spend too much time here. But I do want to make sure that we note that there'll be 2 other questions, so get prepared for those. And here's the second question. And let's see. There it is. Which of the following is an example of an outcome measure? And I am old enough to note, in terms of my history with evaluation, that this was not always the answer. So when we talk about the answer, it wasn't always the way it was. In fact, it was kind of odd the way that it was originally phrased out. But it tells you that our field evolves. And that's important to note, particularly if you're young and just entering the field. This is by definition a very new field. So as you go through it, we're still evolving best practices and best procedures. We're getting better at it. But it's going to take what you do in the community. And as Derek said, your work at the community level is going to inform what happens at the national level, and at the state level. So very good. All right, for the last question, let's move forward. Looks like we got 60 or so % of the people who answered. So this is the last and final of the pre-assessment question. And I know the slide 8 is going to show up. Yep. Why is measuring process evaluation important? And if you don't know the difference between process and outcome, that's absolutely acceptable. That's what part of this training is about. The other thing to note about this training is that it's not supposed to be the end-all be-all. There'll be additional recommendations for training. Hopefully you'll gain some ideas about what you're strong in and what areas you might need additional assistance in. And the good thing is you have the PTTC here. They have trainings on demand as well as customized training and then some specialized training. That's an example around logic models. So as you go through that process, we'll get into a little bit of that discussion. Very good. So we'll go ahead and end the poll here. And we'll move forward with the presentation. So first and foremost, as an evaluator, thank you so much for taking the time to answer these questions. We want to make sure that as part of this process that we not only talk about what the importance of evaluation and pre and post testing, but at the same time, we also talk about what is important in terms of making your program and your process even more effective. All right, we'll close out the poll here. And we'll move on to evaluation. So it's, as you've already talked about this week, evaluation is part of the SPSFS, and we have 5 additional kind of pieces to it. We have assessment, capacity, planning, implementation, and evaluation, and that fits kind of under the umbrella of sustainability and community relevance. So as you move through this process, understand that the idea here is that whatever we do that's effective should be sustained. So when you go through and see evaluation, it really is kind of odd that evaluation isn't unto itself one part. For example, when you did an assessment, you went out and you collected data about what's going on in your community. You created a needs assessment, which is also part of an evaluation. Within your capacity, you had to assess or evaluate whether or not you could implement this program or whether your community was ready for that program. That's also an evaluation. Same thing happens when you start implementing with fidelity. Is if you hired a guy named like Kyle, did he do it right? So as you go through this process, evaluation, though it kind of comes in at step 5, is actually spread across all parts of the SPFF. But the most important thing about the SPF is that when we put in evaluation, we are really talking about whether or not programs are effective and worth our time, but more importantly, worth the time of the participants or those people attending our session. So if we're working with schools and high school and middle school students, is it worth the students' time to be engaged in what we're doing versus what else they could be doing? So evaluation is highly important, and it's also something we do every day that we'll talk about. So what is evaluation? It's important to note that a program evaluation is just a systematic collection of information to assess whether or not a program is doing well. Right? Well, we can do that on several levels. As we talked about with football a second ago, if your team made the playoff, right, if you went 12-0 or 13-0 if you had to go to a championship weekend, then boy, you know for a fact that you have some information that says, hey, our program is on the right track. If your team went 0-12, then you may have additional information that says, I collected this information, we have a program, but it may not be on the same path as others. So as you move through here, we are simply collecting information at the evaluation level to make informed decisions about where we go from here. And that's the importance of evaluation, is that it is designed in terms of once you collect that information, is to be able to make judgments about that program, particularly how to improve it, and what information we need to do about whether or not we need to continue it in its current form, or if we need to make some alterations to the program. And in some cases, those alterations mean going back and revisiting whether or not we have the right curriculum, or whether or not we need the program developers to add to or change the curriculum to better meet our needs. So as you go through the process, the purpose of evaluation is really to improve the effectiveness of our programs. And if you're evaluating yourselves, like many of us do, like pre and post tests, did I help make a change? Satisfaction surveys at the end of trainings. What can I do to become a better trainer as well in that process? There are some benefits of evaluation. Several of those are going to be related to, first and foremost, improving fidelity. And I think this is one of the most important things that we need to talk about in as a field, is that when we do an evidence-based intervention or an evidence-based program, they have already, the developers of that program have already kind of given us the recipe of how to make this thing successful. So if the recipe is you do A, B, and C, but you hire Kyle and he comes in and says, oh, I don't like B, so I'm just going to do A and C, is it going to be as effective? Well, if it's truly evidence-based, the answer typically is no. If you don't go in the correct order at the right time with the right population, which we call fidelity, then you're not going to have as great as strengthening or have as more impactful outcomes. And again, when we go and impact, particularly like in a public school system or a college setting or a workforce environment, one of the things that's occurring is that employer, that teacher, that supervisor or principal is looking at us saying, is this the best use of their time? And if I can't show outcomes because Kyle didn't implement it correctly, then we may have issues with sustainability. And so that's why a good, effective benefit of evaluation is to improve your fidelity options, which we call process evaluation, so that we can improve our outcomes, so that way we can justify whether or not our program needs to be sustained. Now, clearly, if the evidence comes back that says, no way, this program doesn't work, and I've done over 200 evaluations, and in many of those, the first result was we should not ever implement this program, ever again. And that is absolutely acceptable because we implemented it, we had the data, we did it with fidelity and said it doesn't work with this population, we need to make a change, either going back and making the change with the program developer or finding a new curriculum. There is no such thing as bad evaluation. It's just what happens with the data you use. Is it helping you make informed decisions about the future of your program, which is the whole process of evaluation? There are four different types of evaluation that we normally talk about. The first one we already did, which was the needs assessment. That needs assessment could be included what's happening in your community. It is also talk about process evaluation or that fidelity measure. Did we implement with the right training? Did we implement with the right people? Do our people have the right skills in order to implement it? And then did we have the outcomes acceptable to that? So as you go through this process, that outcome then becomes an impact assessment. And typically impact is after the program is completed. So in our example today, we have Riverdale, right? That's the kind of this fictional community that we're working in. And we're doing a vaping curriculum. And now we're assessing it. So one of the things you could do for impact is, let's say high school students got 4 years of vaping prevention. What happens if you follow up 4 years later when they're finishing college or in the workforce? What is their vaping rates compared to kids who didn't get this in high school? That's impact, typically considered after the fact. So let me stop there and first and foremost and say any questions that may have popped up. I don't see anything here, so we must be good to go. Excellent. So again, as you go through this process, feel free to ask questions. We are here for you to answer those questions. So as you go through this process, do not be afraid to ask those. Just put them in the chat. Now, I know at this point in time, when we start talking about evaluations, we get into this discussion about logic models. And I think that's an important piece to understand. And one of the things that occurs is almost all of these, in fact, when I do an evaluation, there isn't a single one, needs, process, outcome, or impact, that doesn't have a logic model. And logic models to me are very, very basically foundational. It is almost the process is I can't do an evaluation without knowing what I'm evaluating. And I can't know what I'm evaluating unless I know what we're implementing. And I don't know if what we're implementing unless I have the resources to implement it. And so when I was a director of a runaway and homeless shelter, we had a lot of substance abuse issues in our community and within the students and the children that we worked with. So we had a pretty robust substance abuse prevention and treatment program. Every single time we implemented any program, we always had a pre and post test, we had satisfaction surveys, and we did fidelity assessments, but we always did it with a logic model. And the reason we use a logic model is a logic model gives us the visual representation, kind of the map, if you will, of where we are and where we're going. It also sets expectations up beforehand. I always hated when I got an evaluation after the fact. And I told you I'm old, so one of the first things about evaluation is it used to be that we would collect data throughout the year on our evaluation. We get a 3-year grant. We collected data for year 1, then we collected data for year 2, and then we collected data for year 3. We put them all in one big box and sent it off to a professor somewhere who did an evaluation after the grant was done to come back to tell us whether we were effective. That is a really poor way to use all that data collection. Because what invariably will come back would say, hey, if you would have made this change back in year 1, you may have had better results in year 2. So as you go through this process, logic models help you understand that process, the logical flow, and then it gives you the built-in time to be able to make programmatic informed decisions. So vital that you have a logic model. You can have a variety of different kinds of logic models out there. Some are very robust and detailed. I've created some that are, dozens of pages long. Other ones are single page. So it doesn't matter as long as everybody can say, this is where we're starting, this is what we're evaluating, and then this is how we are going to do that evaluation. So why use the logic model? Well, as we just talked about, the most important one is that evaluation without structure is basically like planning a trip without having an idea where you're going, right? Or running a race without a finish line, or building a house without a blueprint. So as you move through here, it gives you the individual structures of what we need to see and what we want to see in regards to the program that we're implementing. So one of the ways that I always look at this would be is it was kind of, as you go through this process, a structured logic model is something most of us use every single day. We just call them recipes. Because a logic model is going to start out with something along the lines of, you need these ingredients if you're going to make this thing. These ingredients are going to require these pieces of equipment, a spatula, a cake pan, those kinds of things. And so as you have this equipment and you have these ingredients, I got them sitting there. Now I have to have something and like mix the dry ingredients up or pour the batter into this. Those are called activities, right? And so as you go through the process, we have these ingredients or inputs, ingredients and resources. Now I have these activities with them that I have to be able to do that generate something. Maybe if I'm making a cake, and for those of you who know, I do have a grandbaby. And one of the beauties of having a grandbaby is I don't have to train her on how to overcome adversity. That's what parents are for. Grandparents are giving them chocolate cake. And so every time she cries, she gets a chocolate cake. Every time she's successful at something, she gets a chocolate cake. And she and I now make different kinds of chocolate cake. So we have a kind of a logic model now for a mayo cake, if you will. We're using one now with condensed milk. We're putting some peanut butter in another one. So as you go through that process, each one has their own recipe, i.e. logic model, with the own expectation of what it's going to look and taste like at the end. That's exactly why we have a logic model in prevention. When we normally take about a logic model, it's important to note that most logic models follow the same framework, and it makes some sense to it. We identify a problem, which was step one of our SPF, right? We identify local issues in our community that we're willing to engage and work on. So we have data that supports problems and related behavior. If we're using this vaping example, we have risk and protective factors. It could be kids don't perceive vaping as harmful or more healthy than smoking a cigarette, right? So as you go through that process, we've got these risk and protective factors that we need to deal with. Once we know what risk and protective factors we want to change, we need to know what evidence-based intervention to select. And then once we interview or implement this EBI or EBD, evidence-based program, then we want to have an evaluation of it. So as you move through this piece, it's important to note that problems and related behavior needs a needs assessment or evaluation. Evidence-based interventions, if implemented correctly, it's a fidelity or a process evaluation. But measuring risk and protective factors lead us to an outcome evaluation. So at each step of the way, you use evaluation within the SPFF. And usually that's going to be related around a logic model. Now, one of the things that's important to understand as a field is that logic models are our foundational base, and we're not here to teach you what a logic model is and develop one today, even though you'll see an example. But it's important to note that the PTTC already knows that there are additional needs around logic models, and there's additional trainings that are coming up. There's also some TA opportunities one-on-one through the PTTC for logic model development for your program. And definitely that information will be forthcoming and additional resources may be available. So keep an eye out for that. The other thing to note about it is, why is it important? Why is it important that we put so much time, energy, and effort into a logic model? Well, let me kind of give you this example. The average student in America, middle and high school, and I know that average is kind of broad, but the average person, the average student in high school is going to receive 500 minutes of curriculum prevention. 500 minutes. Well, that sounds like a lot of minutes, except when you realize that's 0.07% of all their academic time in that high school. So they're only going to get 500 minutes, about less than 1% of their time is dedicated toward prevention. To put that in perspective, they're going to spend 900 minutes going to the bathroom during their high school career, during their high school year. So as you go through that process, they're already spending 80% more time in the bathroom than they are getting prevention, knowledge, curriculum, and prevention pieces. And when you can look at that, that's why it's so vital that the limited time we have is done well, and that we're using programs that we know to be effective and demonstrate effectiveness even of the last time we implemented it. All right, so I'll get off my time commitment soapbox. Essential evaluation logic model components are several pieces here. One of those is that, as we talked about with that recipe, we have those resources and inputs. Those resources and inputs then relate to those activities, right? So if I have eggs and I have a whisk, well, I need to crack the eggs, put them into something, and whisk it up. That's an activity. Once those activities are complete, they become outputs. Those outputs could be 2 pieces of a cake, right? 2 layers of a cake. And when I stack them on together, I have one completed cake that's iced. If we stop there, then all I've been able to assess is that I could bake a cake, not the outcome of whether it's good or not, or had an impact or not. When we do evaluation of prevention programs, the same thing. Do we have the staff? Do we have the resources? Did they get the right training, which is the activity? Did they complete the trainings, and do they understand the curriculum, which is the output? And then once it's implemented in a school setting, which also is an activity with a partner, did the outcomes show as we wanted? And then what is the long-term impact? Those are the evaluation logic model components. At this point, what I want to look at then is what an evaluation template or a logic model might look like. And this should look very familiar to you. Resources, inputs, activities, outputs, and then we have those outcomes, and we spread those up over short, intermediate, and long term. So one of the things that's important to note here is that we're going to have those resources we're going to fill out, and I want you to start thinking about that as an example here in a minute when we start looking at a vaping exercise. But then we're going to look at the activities that have to be implemented and some of the outputs. So in your chat right now, let me just go ahead and ask you first and foremost, have you been dealing with or have you ever dealt with a logic model? If you have, go ahead and type that in as either yes or no. And I'm looking at the chat now, got quite a few answers. Very good. Yep, a lot of yeses, very good. So you should be very familiar then. Oh, a couple of no's as well, so welcome to the world of logic models, part of evaluation. Okay, and yes, but not the lead, excellent. Once you get into writing them, it's actually very satisfying to write a logic model and then see it implemented in action. Very good. Thank you very much for participating. So as we go through this process, then one of the things that's important is you're going to have these resources, and without resources, you can't have activities. So if I don't have the staff, I can't implement the program, right? And if I don't have the staff who are trained, then I might not be able to implement with fidelity. So as you go through the process, we start breaking things down so we know when we're ready to start the implementation. If we don't have staff, and we don't have the curriculum, or we don't have them trained, then we're not ready to start. So it tells everybody in the organization and all of your partners when the program is ready to be started. When we have the funding, we hired the staff, and everybody's trained as an example. Very good. Again, thank you for filling out and interacting via chat. All right. The other thing I want to talk about is outcomes real quick. A lot of people get confused about short-term, intermediate, and long-term. You don't really have to get overworked up about it. If you think about common human behavior and history of education, even though it changes and there's always outliers, normally there's an increase or a change. Short-term is knowledge-based. Then knowledge-based begins an attitude shift. And if you have a knowledge-based change and attitude shift that's in the same direction as the knowledge gain, you're going to have a long-term change. So as you go through here, one of the things to note, short-term, intermediate, long-term, knowledge, attitude, behavior. So if I can increase the knowledge about the harmful effects of vaping, I should have an attitude for people who are less likely to want to try it. So long-term is I'll have a reduction in past 30-day use or an increase in individuals who never use. So that's how those short-term, long-term processes work. So that's kind of evaluation in a nutshell. So let's take a look at it, what it looks like if we're using vaping. Now we pick kind of vaping out of the, in theory because we wanted to give an example to everyone, but it could be any program that you're implementing for any cause. So as you go through, it could be suicide prevention, substance abuse reduction, vaping as an example just happens to be what we're focusing on, but that's not the only time that you would use an evaluation logic model. So we're going to apply evaluation to use vaping. You're going to get a handout here, and we're going to talk about that here in just a minute. But on that handout, one of the things we're going to talk about is what type of program we're going to implement and why. But here's some brief data. So as we talked about here, when we're talking about youth data, we already have this fictional town of Riverdale. We have the assessment, the capacity, the planning, and now they're starting to implement, and now it's time for evaluation. So as we do a quick review, here is what some data might look like. So we already collected data in step 1, which was our assessment of community needs. And we said, hey, we're starting to notice that students are increasing their use of vape over between 7th to 12th grade. So in particularly, one of the things that happen is those who report never use are starting to decrease. And they go from 85.6 in 7th to 12th grade where you have 72%. So as you go through the process, our biggest changes appear in 8th grade, 10th grade, and then again in 12th grade. So as you move through these processes, we're using data to inform the idea that, hey, this is a problem. And more importantly, when we start looking at past 30 days, we're starting to see some significant changes there as well, past 30-day use. So as you move through it, it definitely indicates to us that we need to do something in the middle school and high school. Doing it in high school may not be quick enough, since youth seems to be starting right at about that 7th grade area, and is starting to decrease with never use and increase with past month use. But that's not all we need to know. We need to know is our students usually aren't just classified as students. We need to break them up by other indicators, and one way we can do that is by gender. And so one of the things we want to look at is are male and female youth reporting the same. We call that disaggregated or breaking apart. So when we disaggregate, one of the things that we note is that females tend to use more often than males. And so as you go through that process, we need a program that works with both males and females in middle school and high school. But at the same time, we need to make sure it's strongly indicated that it has some evidence that it's effective for females and not just students in aggregate. Because clearly, in this scenario, which is real life data, we're having females report greater information, right, and greater use. So as you move through this process, you could break this information down by students who may be from a single parent household or households where both parents work or college education or other characteristics or criteria in your community that you find important. So as you move through here, we looked at it through a disaggregation vessel of gender, and we're starting to see that that is something we definitely need to hit. We want to make sure now that you turn your attention to the handout number 1, which is evaluation in action, which gives us, after looking at this data, you would go back in and you look at your capacity and you would start planning. And one of the things that this community did is they looked for a specific program. And that program is the Stanford model for vaping prevention. So as you go through the process, they wanted to implement that program. And so we're going to start putting together a quick logic model of what that might look like and what we might need to have from that individual piece. And particularly, I want you to note on page 2 of your handout. So let me go back to chat real quick. Does everybody have their handout? Yep. Okay, very good. So go to page 2. The handout has quite a bit of information on it, but really that's kind of the structure of what you would come up with as to why you would pick an evidence-based program. And so we're going to go to page 2 in particular, and we're going to look at the 3rd bullet point specifically. And so as you go through that process, it shows that studies show us that it's used both in high school and middle school. So we know then that that is a program that we may want to implement in it. And it also talks specifically about the fact that what they need is that we're going to need staffing. We're going to need to make sure the staff are trained. And then we're going to want to make sure that when those staff are trained, that they are implementing correctly in the middle and high school, depending on how they were trained. So what would be a resource? Based on that handout, what would be one of the resources that we would have? And you can use your chat. Training from Stanford, very good. So we're going to definitely have to make sure that we have resources as training, very good. The curriculum itself as well. We also are going to need staff, very good. What do we need before staff and instructors and curriculum? What do we have to get those things in place? Oh, need a link to it. Money, very good. Excellent. So one of the things that happens is we need the money first, then we're going to have to hire the staff second. So as you go through that process, very good, these are the kinds of things you start looking for in those original logic models, right? It's just telling us what we have to have first before we move to the second, right, into the second step. So if we go through here, we start filling it out, this is one way that we could represent it. So in this case, the community went with a United Way grant. They wanted $75,000. Writing the grant isn't the output. The actually getting the award of $75,000 was the output, but it's also not the outcome. We just don't stop there. Then with the $75,000, we hire 2 staff members and we train them, one in middle school in this case, one in high school. Then we also have an output or a resource of making sure we have an MOU. The activity is to write and get it submitted, which means signed. So we have 2 MOUs, one with the middle school campus and one with the high school campus. So once that's done, then we move to the next part, which is going to be our outcomes. Now, if we stop here, right, if I just did an evaluation right here, we would call this a process evaluation. Because if I stopped back here and I said, this is all we're going to do, and I could add another one in there that might say, implement and 750 students attended, and that's all I did. This would be something called a process evaluation. And when I started evaluation work back in the 80s, 1980s, one of the things, some people will say 1880s, my kids especially, but no, it was 1980s. One of the things that occurred is all I had to do was count butts and seats, right? Literally, they would give us money. We would build a curriculum. We would implement that curriculum, and they didn't care about outcomes, they being the government. All they wanted to know is how many people attended. They didn't care if they attended and then walked out, if they slept through it or not, or if they learned anything. It was just butts in seats, kind of like a theater. So as you go through that process, that is a process evaluation. Did we implement it as we were supposed to? Did they get it in the right dosage? If they were supposed to get 10 sessions, did they get all 10 sessions, or was there a fire alarm? Did we reach the population that was intended? Not elementary school. This is for middle and high school. And did we make any adaptations, right? Adaptations typically are things you can make if a picture's changed, but normally you're going to go through a program developer to ask for those adaptations. So that's process evaluation. But in our case now, we want to look at those outcomes, those short, intermediate, and long-term outcomes. And I want you to refer to your second handout here, which is Evaluation Action Handout 2. Now, there's a lot of information on this, and there's separate trainings for SMART objectives. So as you go through that process, we're not going to break it down into SMART objectives overall. But on that final page in there, it does talk you through an objective related to making something smart. And it takes a simple statement such as, we want to reduce vaping, or we want kids to stop vaping, which we have seen many, many cases as an objective or a goal even. But it really isn't SMART. It's not specific, measurable, really not really achievable. It's not realistic because it's not time bound. We don't know in what time period that's happening, and we may never be able to eliminate it all, but we might be able to reduce it. So as you walk through those steps in that handout, you get to a SMART objective. At the bottom of it, it talks about after attending this training by this time period, we're going to go from pre to post on recognition of the harmful effects of vaping. So we have it time bound, we have it specific, measurable. It should be achievable because that's what the curriculum said it was. So in this case, we're going to look through some of the examples of what we can put into our logic model and related to vaping. And specifically this case, we're looking at that Stanford training model. So one of the things we can look at is an increase in knowledge, an increase in perception of risk or harm, a decrease in intent to use. We can also look for our peer norm shifts. Do you think your friends will more likely use or not use, right? That's that peer norms shifting. And then we can ask specific questions about behavior, 30-day uses and decreases, right? 30-day use decreases. It's important to note that there are state laws now that are coming out that are changing up how we do some of the surveys, and we're going to address that in a little bit. But there's always a way around those, and we'll talk a little bit about it. But do note as you go through here, this is where we want to make sure, in terms of logic model, that we start putting these pieces together and making them smart. So I want you to take a minute or two, and I want us to kind of, in your chat, if you would, what is going to be a short-term outcome, and how would you measure that? So what is a short-term outcome that you would use using that piece that we just described using the Stanford model? And I picked that out because it is evidence-based, but there's many others. So if you're not using the Stanford, that's absolutely acceptable. There's plenty more that have that and have the same kind of processes of what minimum requirements they have. So let's take a look at chat real quick. Increasing knowledge of the of the harmful effects of vaping, very good. So one is of increasing the knowledge of what's in vape, right? And when you start reading that history and starting reading what's behind it, it's kind of scary about what really goes into a vape contraption and what we really don't know goes into that vape, metal, and other chemicals. Decrease in usage, right, with knowledge. So increased knowledge hopefully decreases use, right? Increasing knowledge and accessibility, right? How accessible is it? Perfect. Reduction in student use, very good. Lessen the likelihood of starting, right? So if I increase knowledge, right, that's the first step. If I can increase the knowledge of the harmful effects, or at least what's in it and knowledge of it, I might have people who don't want to use it. Okay. Perception of harm, very good. Perfect. So as we go through that process, now change it. How would you measure those? So think about that. If we're going to increase knowledge about the harmful effects of vape, how would we measure them? Pre and post test, very good. And if you have an evidence-based intervention or an evidence-based program, many of them come with their own pre and post. The other one is absolutely, Andrea, is using data in the community. You may already have a survey you're using and you can look over time, absolutely. Pre and post survey. If you can't do pre and post survey, you can do other things. You could do focus groups and talk to students before and after. Right? You can look for anecdotal evidence such as going to retailers around the school to see if sales have gone up or down. So as you go through those pieces, there's multiple ways that you can collect this data, but the easiest and most efficient is through a survey or pre and post test. Excellent. Very good. So if you go through this process then, and you would do this for each individual outcome, so you'd have a short term, an intermediate, and a long term, and you may have multiple objectives for each of these pieces, then your logic model starts to get filled in. And this is an example of what a logic model would look like as it's starting to get filled in. Now, I know that Nicole is chuckling at me because these outcomes are not smart, right? Because they don't have time bound in them. They don't have a percentage, right? So as we go through there, this was just put in here to give you an example of what it would start to look like, but we'd still have to do some refining even of these. So a lot of cases in your programs, you're going to focus on the short and intermediate. Long-term may be beyond the scope of your grant or even beyond the scope of the program, but it's still something you want to start looking at as to how you would know long-term decreases in behavior are noted, right? So typically short-term is knowledge, intermediate attitude, long-term is going to be the behavior piece to it. So that's the process of logic model and the youth vaping piece, right? So we start out with those resources. We got to have funding, we got to have staff, and we got to have an MOU, right? Because it doesn't do me any good to have funding and staff if I can't put them into a school district somewhere. Those activities are to write a grant, hire 2 staff, and make sure I have an MOU, that those 2 MOUs are signed, 2 staff are trained and ready to go, and that was all available because we got that grant for $75,000 in this scenario. And now we can start tracking. And we would change these up each year based on what we know and what we learned from our first year's implementation. So let me stop there. Any questions related to this? All right, very good. Perfect. It is lunchtime, so you may just be saying no questions, just get us to lunch. So working on that. Couple of things to note about outcome evaluation is, as we've already talked about, is usually short term is going to be that knowledge change. Then you have attitude and you have behavior. And I like this slide because I used to coach soccer. And so when you start talking about short term, some of the short term knowledge that I did with soccer students was the idea that, hey, there is a sides and sections of the field that you play on. You need to stay in your section and your side. And so one of the things that occurs, if you ever seen young kids, particularly, like 8-year-olds playing soccer, they're running after the ball and they go all over the field. My goalie was on the other side of the field running after the ball, right? So first thing is short term, let's just get them knowledge of the field, let them make sure they understand how things are sectioned off. Then the next thing is we want to teach them is, hey, okay, this is your section. How do you defend it and how do you attack from it? Because every position on a soccer field has an attack and a defense capability. And then the long-term one is they are actually starting to work as an entire team. You can do these because you have these outcome data, but you can break those down whether it's soccer, football, or doing interventions in the school, where we talked about attitude change related to knowledge first. Once kids start understanding, hey, maybe it's not as healthy, then we have change in attitude, and then we have a change typically in behavior. Same thing happens when we do things like, I want to get healthier. Well, the first thing I want to do is I want to learn more about healthy eating. That may give me a more likelihood of having an attitude to embrace eating kale. And then once I eat my kale, then maybe a long-term behavior change gets positive. This and these are examples. Now, a couple of things to note. Look at what you can do, right? These are different examples of what people have done with vaping. I want to draw your attention to the very last one, right? And that's where they're actually collecting saliva, right? And so it is part of evaluation where you go in and collect information, including bodily fluids in some cases. Now, if you're going to do that, you want to make sure you clear all your legal ramifications, such as IRB, as well as making sure that's clearly articulated and everybody understands it. But different levels, different studies require different level and different techniques for assessing pre and post or outcomes. All of those are possible. Pick the one that's easiest based on your capacity in your community and based on the planning and implementation of the program. If they require pre and post test, then we need to make sure we implement it. If your community isn't ready for pre and post, you may need to look at a different intervention. So outcome in terms of the vaping example, it is very important to see that there's multitude of ways of evaluating it, more than just what we had said. Now, because this multitude, there's a lot of states now that are looking at legal considerations, and particularly really in Texas, as an example, we have Senate Bill 12. And I know many of you or most of you are not from there, but you may be in a state that are being impacted by these decisions. Just know they already exist. We already have FERPA, which talks about parental rights and access to students' education. But more important, we have PPRA, right? Protection of Pupil Rights Amendment. That's been around now for decades. It specifically said you had to get active consents before you could administer a survey from the U.S. Department of Education. So if you got a U.S. Department of Education grant, you were implementing a vaping program, and you did a pre and post test or a pre and post survey, you needed to make sure you already had an active consent. State in Texas, for example, and other states are doing that. They've just increased PPRA into the state level. It says it doesn't matter if it's a U.S. Department of Education grant-funded survey. All surveys have to have active parental consent if it's related to attitude or behavior, but not knowledge change. So in any state which you go through, pre and post related to knowledge are usually acceptable. It doesn't require active consent from a parent, but the moment you ask attitude and behavior, then you got to make that change. There'll be additional trainings on this coming up as more states are impacted by this. You can definitely reach out to the PTTC. So as you move through those processes, there are a multitude of ways of getting answers to your questions. Just know they're still new, so they're still working their way through the system, particularly the legal system, before we get some clarity exactly when and where everything applies. But it's not uncommon, already been there with FERPA and PPRA. So let's go in with a post assessment. And we're going to have that poll show up here. And in that poll, I want to go back through and let's see what we do. I wrote down the first one. Let's see how we do here. And we're going to give everybody a few minutes. And we'll let that poll run for until about 1 minute. So we got 30 seconds left. And participation rate is good. So we're at 55%. That's good. Unless we had a lot of repeated people, but I think there's procedures for that. All right, just about 10 more seconds here. All right, it looks like assess how well a program is working and improve its effectiveness is the winner at 91%. And that's absolutely correct. So you definitely can use the evaluation to collect data for your grant reporting. It's essential that you do that. To prove that a program is worth funding is definitely possible, and replace outcome data with process data. That definitely is something that has been done, as we talked about earlier. But the overwhelming reason to do evaluation is to assess how well a program is working and to improve its effectiveness. So very, very good. Excellent. Let's go to the second one. Which of the following is an example of an outcome evaluation measure for a vaping prevention curriculum? And we talked a little bit about it. But as we go through here, again, we're going to let everybody have about 45 seconds or so. Looks like our timing is good. I don't see any throwing emojis from the powers that be at PTTC, so I'm not in trouble yet, gang. So just give it time. All right, we'll give about 10 more seconds here. Very good. And it looks like 94% identify the percentage change in student perceptions of vaping-related harm is an example of an outcome evaluation, and that's accurate, right? So the number of lessons delivered is an evaluation, but it's more process related, not outcome. It's more of, did we implement it correctly? Or did Kyle mess up again and skip a slide or not do everything he was supposed to, right? Glad to see nobody had satisfaction in there with the instructor. That is not an outcome. You know, that could be related to the instructor's outcome measure, but not related to vaping. And then the number of students who attended the curriculum is also a process measure. Again, butts in seats versus what we know. Outcome is about change in attitude, knowledge, or behavior. So as you go through that process, very, very good. Excellent. And that showed an increase of 2%. So as you go through the process, I did not increase question number one, my failure, but we did number two. So I'm batting 50-50 right now. And that's on me. I'm the instructor. This is evaluating me and how well it did, not you as the audience. So it tells me where I need to correct and what I need to get better next time. Whoop. Question three. Why is measuring process evaluation, fidelity, dose, reach important? Same here. We'll give everybody about 45 seconds or so to finish up this survey. And again, this is one of those things that's important to do as an evaluation team, as part of implementation. You want to make sure that your team is implementing correctly, which is part of that process, that fidelity, dose, and reach. All right, about 5 more seconds here. All right. Looks like about 97% answered it determines whether the program was implemented as intended and helps interpret results. And that's exactly what a process evaluation is intended to do. It can, and some people used to believe that it proves that a program worked even if no outcomes were changed, right? Because you implement it effectively. And that actually is what we call, in what I call, I won't say we, I call the domino, right? If I know this is an evidence-based program, and I implemented it effectively, then I shouldn't have to show the outcomes. But what we have learned is that individual schools, individual communities, individual workers and employers that we deal with want to know how their employees did, not just that you implemented correctly. They want to know what was the outcome of their staff, their students, their employees. So as you go through the process, that number 3 there used to be definitely true, but it's now more and more that it determines whether the program was implemented as intended and helps interpret the results, right? So if Kyle didn't do it right, no wonder we had this failure, right? So you can tell in this case, we went up 7%, so a 7% increase, 90 to 97. So that's almost a 9% overall change increase. Did good on number 2. And then I still got to work on number 1. So I'll do that next time. So as you go through this process, as we do this wrap up, a couple of things I want you to be aware of. Don't forget how limited amount of time we have with our students the group that we're working with. Prevention is absolutely essential, and we have limited time to do it. And because of that limited time, it is only possible that we are going to make an impact in these kids' lives and these individuals' lives that we're working with if we use evidence-based programs effectively and we show that they work with outcomes. The other thing to note is, and I'm going to echo what Derek said at the beginning, change in our field is difficult, but it's only going to come from those in the community who actually do the work. If you do not collect data and you do not report your findings, whether they were effective or then say, hey, this worked, or to say, hey, don't ever do this, you need to publicize that information. You can do that in newsletters, blogs, or in peer-reviewed journals. Change in our field comes from you. It's not going to come from Washington, because if it does, it's usually messed up, and I'm not trying to be political. It doesn't matter the party. Change out of Washington downward usually is not effective. Change upward is the most powerful one we have, and you're doing the work. Who knows better what works than you and your teams? Have your teams collect the data. Get that data out there, so show people what is working in our field and the impact that's being made. It's vital that we do that, and evaluation is how we can do that. Whether we're doing that through process evaluation, a needs assessment, outcome, or impact, do it. The final thing I will tell you is make sure in your field that you use your data accordingly. Get published if you can. We are a field that is in desperate need of high quality individuals who will tell us what's working. That will inform practice. Thank you so much for being here over these last several days. Thank you for being here, particularly for these last 55 minutes or so listening to me. So as you go through that process, I'm going to turn it back over to Derek and anybody with any questions. Thank you so much, and keep doing the great work that you do.
At this time, we have questions and answers. We have about 3 minutes where we'll give you the opportunity, if you need to open your mic, because maybe you couldn't participate in the chat box, you can ask your question live. We need your evaluation, as we talked about earlier. Your feedback is extremely important to us. So if you could use your smartphones and complete the survey. If not, we're going to put a link into the chat as well, and you can click on the link and complete the survey. We need your feedback to ensure that our programs in the future are exactly what you want them to be. That's how we get better, is by getting our data collected, just like Kyle talked about. So I encourage you to take what you've learned today and apply it in a manageable way. And I want you to start with the questions that matter the most. Use the data you already have and let evaluation guide your next steps. Just remember, strong prevention work is adaptive, reflective, and it's definitely rooted in real-world experiences. So we thank you for walking through this series with us together, from assessment to capacity to planning to implementation and now evaluation. The work you are doing to address youth vaping is important. All of your work is important, and your dedication definitely makes a difference. We appreciate your partnership. We look forward to continuing this work together with you. And I encourage you all to continue the work that you're doing, because in the end, evaluation helps us ask better questions, make informed adjustments, and demonstrates the impact of our efforts. And that's how we grow our field, as Kyle has so much emphasized. Get published. the work that you do, is extremely important. It matters. I'm going to put us in the hands now of Nicole to go ahead and close us out for the next slides.
Thank you, Derek. I just wanted to let you all know that if you need further technical assistance or have questions about today, feel free to email me at nicoled@ou.edu. We do provide evaluation technical assistance and also logic model technical assistance. If you're in our region, we're going to have about 25 hours of free TA, which includes a face-to-face session for 3 lovely programs this year. So feel free to email me and we can start determining eligibility and see how that's going to look. I also want to point out in the chat that we are doing a logic model session in January, and the lovely Katie Shikoyan will be doing that. So look for that registration in the chat. And there's Katie waving. So you all saw her earlier this week. And just to say thank you, everyone, for this lovely week. We have really enjoyed being here with you. And Kyle, thank you for being here today. It has been awesome to see the participation this close to the holiday and taking up your lunch hour. So thank you all as participants.